Hello everyone. Yeah, my topic is in vitro and in vivo effects of traditional Chinese medicine formula T33 in human breast cancer cells. Okay. According to my we should do some review about the distribution of cases and deaths for the top 10 most common cancer in 2020. We know that the very first place, no matter in incidence or mortality, it's also the breast cancer. So that's why we try to figure out, and we use herbal drug to figure out this problem. Okay. Okay. Also, the next we can figure out depend on the region-specific incident and mortality age, standardized rates for female breast cancer in 2020. So you know, maybe in Western Europe, maybe Northern Europe, the breast cancer also take the very first place. Okay. The next, okay, we now to share some existential plights of breast cancer. We know that there are three subtypes of breast cancer. First of all, the ER and PR positive, it takes about 65 to 70%. But after the patient received the therapy, maybe 10 to 40 months, they will treat to develop drug resistance. And the second subtype is HER2 positive. It takes 15 to 20%, and it shows much more drug resistance. And the third subtype is TNBC. It's triple negative breast cancer. It takes 12 to 15. Nowadays, there's not an effective therapy for so far. And also, you know, all these three subtypes breast cancer, they all receive the chemotherapy, and we check and review some article. It shows that the chemical therapy could accelerate metastasis and make the breast cancer much more recurrency. Okay, so this is the main components of the T33. First of all, we call in Chinese terminology, we call it 芍药, Pannonia lactifolia, and the second we call 甘穗, Euphorbia 甘穗, and the third we call 甘草, Glycyrrhiza of Arlensis, and the fourth components we called 半夏, Pinella tonata, and the fifth component we call 大黄, Rhubarberum. Okay, this is 5 main components of a T33. And I've used this component, I mean this formula, to treat my patient over 1 decade. Okay, now this is the experimental flow chart of my research. Okay, and next, the first illustration we want to show you that T33 could reduce the proliferation of MDA, MB231, and NCF7 cells. Let me explain that MDA, MB231 cell line represent the TNBC cell line, okay? And the MCF7 cell represent the normal breast cancer cell line. As you can see the illustration that after 24 hours and 48 hours, as the dose increase, we can show that the 2 type of cell line, they just decline and they increase the cell viability. But we also can figure out the control group. The control group shows the highly cell viability, but in highly dose. This in Chinese terminology we call this a dose dependent. So it's not that the more the higher the dose, get the better results. Okay, there's the second illustration that we want to show you that T33 can reduces the invasion of MDA-MB231 and MCF7 cell in vitro. And according to my clinical experience, I've treated lots about 100 patients to make them feel better. And after they come to my clinic, we need to check their image, and they show a much better result. There's no metastasis, and also in vitro, we saw also this kind of results as well. Okay, the third illustration that when I show you that T33 induce autophagy. Of course, the autophagy is about the cancer cell. As you can see, the LC32 represent the, as you can see, the with the plot, the bar shows the higher density, represent the higher dose the cancer cells experience went through the autophagy process. Okay, you can see that the higher doses, no better MDA-MB231 and MC7, that shows higher ratio. LC32 represents the high dose of the autophagy process. Okay, according to this illustration that we can see some cytokine and protein complex. We can see the ATG7 and ATG5 and BACK1 and P62. All these bar, we try to figure out one result that is the higher dose, a higher density of the Western blot bar, they express the higher, make the the cancer cell went through the autophagy. Okay. Also the MDA. Okay, next. Okay, we can see the in vivo. T33 suppresses the growth of xenograft of MDA-MB231 and MC7 cells. As you can see, the illustration shows a very great results. Okay. So we want to show you that no matter in vitro or in vivo effects, the T33, we make the cell line went through this kind of process. And most of all, we find a method to make the cancer cell to eat themselves. Okay, let the cancer cell to eat themselves. Okay, we also can see that the herbal, we can show some article that first of all, when I introduced the Bansha, it can inhibit the MAPK pathway. We know this is cytosis, the pathway, and the ganshui, it can regulate the PI3K and the AKT pathway. Next, we can see the Shaoyao. It can regulate AKT-mTOR autophagy signaling pathway. And the Gancao, it can regulate the ROS and mitochondrial pathway. And the Dahuang, it can regulate the AMPK-mTOR signaling pathway. All that help to make the cancer cell to went through the make the cell death. Okay. After that, we just review the autophagy process. As you can see there, the red circle, the first the left side, we can see the BACK1 complex, and the second process we can see the ATG5 and ATG7 complex, and then we can see the right side of the illustration. We can see the LC3 complex. So this illustration explains that, as you can see, the complex more shows more that represents the cancer cell went through the autophagy process. Okay. So next, we want to try to tell everyone that, as we know that since there is multi-drug resistance happening, And then that the T33 shows the multi-drug modulation. This is what to try to tell you, okay? Okay, this is the first case. I want to show the case report. This is a 35 years old woman. He come to my clinic last year, 2003, and in February. This is a TNBC case. And nowadays, this patient shows, you can see the report. There's no evidence of micrometastasis, and there's no evidence of micrometastasis. Okay, the patient nowadays is 2024. The patient is all cured, the complete cured. Okay, this is the first case. Okay, the second case is she's 52 years old, and this patient come to my clinic at 2020 September, and the patient got a huge tumor. As you can see, the illustration left side, it is 12 centimeter, and we also combine, the Western medicine and combine the herbal medicine as well together. And as you can see, the time actually goes to the 2021 February. The patient received a surgery, and they do some biopsy about the residual mass. You can see the report that the mass node growth is found to be composed of benign and necrotic elements. No carcinoma is seen. This patient is also a TNBC patient, but this patient is now completely cured. So I try to use these two cases to make everyone to realize that we do find a method to let the cancer cell eat themselves. Okay, so we make this all 5 components to herbal tablet. We make it a name, Herbal Express. Now we use this tablet to give the patient every day. Okay, so that's my daily work of a breast cancer patient. No whether the patient she's diagnosed about breast cancer, no matter now after you receive the surgery, and maybe now you are receiving the chemotherapy, maybe now you are receiving a radiotherapy, or maybe now you are receiving a target therapy, all can take this herb express, and then we want to make them to induce the cancer autophagy and then make the inhibition of the cancer proliferation and inhibit the metastasis. Okay, finally that's why we want to hope that the T33 is the strategy of the breast cancer cell. Thank you.
Okay, so I want to ask one question from you. Like as you said, you are using this composition from last 10 years to do the treatment.
Yes.
So how you have optimized the composition of this, like it was a 5 components. So and you said like if the doses are high, the results are better than that. Then till what the doses, like the proposition you went, I want to know just like the how you have finalized the proposition and amount to be given.
Okay, this is a very good question. It based on the ancient theory of a TCM, because I want to share with everyone that all these 5 components at the very first beginning, it's try to help the edema. The cancer patient, they might remove the lymph nodes, and after that they might have some symptom that for extremity, maybe the upper extremity edema. First of all, we just try to use these 5 components to release the edema. But after that, the patient they use this formula and come to my clinic, and we check the biopsy, the report that the Western medicine did for them and we checked the imaging results, we found out this patient become much more better and better. So that's why we just try to figure out whether this formula can treat the cancer as well. So that's why we want to do this research, and that finally we found the result. We did can make all these cancer patients feel better. And you mean that the dosage? Sorry, that depends on the experience of our. I treat all these patients about over 15 years. I help to treat all these patients every day so far right now. Thank you.